Most, if not all of us, will experience a traumatic event at some point in our lives. It can be anywhere from the death of a loved one to an accident resulting in injury, natural disaster, and so on. Some experience the after effects of trauma for a short period of time, while others may feel it for years after the incident. This difference is what can lead to the development of PTSD. PTSD is a complex psychological disorder that affects 3.5% of the population and can affect anyone regardless of sex, gender, age, or culture, according to the American Psychiatric Association. There are current treatments and strategies in place that have been for decades to treat PTSD. However, with the changing times, the popularity of alternative methods have become more and more popular, some that many would never expect. For instance, would you think that a party drug may be the potential cure for PTSD? Not many people would, but it just might. Now, what exactly is PTSD? PTSD can be caused by a variety of traumatic incidences. This visual comes from the Lancet Journal, which describes a visualization of a study done on over 2,000 18-year-olds in England and compares those experienced trauma versus those who have PTSD. And these can be direct assault or threat, direct accident or illness, witnessed assault or illness, and network trauma refers to trauma experienced in early childhood. According to the American Psychiatric Association, symptoms of PTSD can manifest themselves in 4 ways. Those being visual, which can include nightmares, strong memories, and in severe cases, flashbacks, which can cause the individual to feel as though they are reliving the traumatic experience. They can come under avoidance category, which can be avoiding any experience or stimulus that can evoke negative thoughts or feelings or even remind them of a traumatic incident. Cognitive and behavioral symptoms can look like self-blame over the traumatic incident, as well as a warped self-image and memory problems regarding the traumatic incident. Changes in arousal and reactivity can look like hyper-awareness to surroundings and people, as well as anger outbursts and easy irritability. While symptoms and severity are unique to the individual, everyone who has PTSD is affected by their symptoms daily. PTSD is a complex disorder, meaning that it requires 2 to 3 simultaneous treatments at a time. Some current treatments fall under medical or therapeutic. Some current medicines that are being used are selective serotonin reuptake inhibitors, which are drugs that target the blockages of serotonin in your brain. A selective norepinephrine reuptake inhibitor, which acts the same but targets norepinephrine. And other medications can be prescribed to treat other symptoms, such as anti-anxiety and sleeping medications. Some therapeutic approaches, the main is cognitive behavioral therapy, in which an individual works one-on-one with a licensed mental health professional. However, alternative therapies such as acupuncture and animal and nature therapy are becoming more and more popular. One method that not many would expect, but so far has the most promising results, is the use of MDMA during therapy. Now, if you don't already know, MDMA is a psychoactive drug that targets serotonin receptors in your brain. This visual comes from Wikipedia and demonstrates the release and absorption of serotonin. These little blue circles represent neurotransmitters, which are chemicals in our brains transferred from one cell to another to tell the cell how to function. Serotonin's main job is in mood regulation, and most often with pleasure and happiness. Once MDMA is consumed, the production of MDMA would look like this: double to quadruple normal production, which can lead to increased feelings of pleasure and euphoria. Now, with this feeling of pleasure and euphoria, it can be used to treat PTSD in a supportive therapy model. The Multidisciplinary Association of Psychedelic studies the impact of multiple psychedelics, but it also looks at MDMA with PTSD. This one story comes from a study, but looks at 2 patients who underwent a trial. In this trial, they were to be tested at baseline and then given 3 treatments with 2 months in between under the influence of MDMA. The 2 individuals in this story are Stuart and Josie. Their names and personal details have been changed or hidden to protect their confidentiality. Stuart is a patient with PTSD who has had no prior cognitive treatment for it. Josie is his romantic partner and has no underlying illnesses, however, reports an inability to relax. During the before the sessions, they rated their relationship satisfaction at a 3 out of 6, with a 0 being the lowest. During the first treatment, Stewart experienced strong emotional outbursts. However, he did not run away from them or try to escape them as he did in the baseline treatment. Josie reported finally being able to relax and as though she felt the presence of God. During the second treatment, Stewart was able to have moments of peace amongst the outbursts, and Josie stayed consistent. After just the second treatment, however, Stewart's symptoms were next to 0, and both Josie and Stewart rated their relationship satisfaction at a 5 out of 6. So what exactly does this mean? The conclusions from this say that MDMA can bring patients a sense of peace in order to delve into and explore past traumas and reshape ways of thinking. So in conclusion, PTSD is a complicated and hard to manage illness that affects thousands of people. While some current treatments show success rates, the studies using MDMA reveal that the use of a psychoactive drug can produce enough serotonin to allow individuals to guide themselves through revisiting trauma and reshaping the brain. This can have major implications for the power of our mind and the future of mental health.